The topic is health is now a technology industry. Health is now a technology industry. We've got 3 people on each team vote either arguing for or against that proposition. 6 minutes in total per person, a warning bell at 5, a cacophony at 6, and the winner is decided by the clapometer. Hand up if this is your first go at seeing this. Quite a few. The clapometer is this. In a second, I'll invite the affirmative team members. There's only 2 because, of course, we've got virtual debaters in the era of COVID. This is the affirmative team. This will be the negative team. I'll say, if you agree then, you'll clap, and this is what will happen. My arm will go like that. And if it's, you see what I mean? And then you'll do the other one, and the arm will go like that. And you measure the winner by how far the arm goes up. And you'll be amazed how accurate Julie's clapometer is. Seriously, I don't rig it. It's often really easy to tell. Okay. Ladies and gentlemen, let's meet the teams. I'd like to invite for the affirmative, firstly, Dr. Lindsay McBride. She's up in the atmosphere in digital. Would you also welcome Dr. Amelia Lewis, clinical neuropsychologist, disability support unit, and Dr. Alice Gray, RPA immunologist, and also the director of the Basic Physician Trainee Network. And our virtual person is Dr. Lindsay McBride, who's the visiting medical officer and an anaesthetist. I'm sorry she's not here because I was hoping she'd just help me with some medication, but she's only virtual. I do beg your pardon. There, see, that's what Sydney's like. It can change like that. Ladies and gentlemen, for the opposition, coming into the room is Quiva Scales, senior exercise physiologist in palliative care. I welcome you. And also virtually, up in the air, Dr. Rebecca Davis, Deputy Director of the Royal Prince Alfred Virtual and RPA Emergency. Don't you think it's funny that Rebecca works for Virtual and she's debating virtually? I find that interesting. And then our third person is Mr. Tony Tu, Digital Health Coach. And here he comes. Would you make them all welcome, please? Well, here we go. So you can see the timers in front of you, ladies and gentlemen, but you'll go up to the lectern. Are we ready to begin? You just want to give them a huge clap to G them up? Now, our first speaker, arguing for the affirmative, so arguing for the proposition that health is now a technology industry, is joining us virtually, which is just amazing. So please welcome Dr. Lindsay McBride, Visiting Medical Officer, anaesthetist.
Excellent. Healthcare is now a technology industry. Well, definitions, healthcare is what we provide, no doubt about that. Industry. We are a service industry, and I think there's no debate that we are an industry. The affirmative team, here we are zooming into the future of healthcare, and we are going to make it clear to you, learned colleagues, that this is absolutely indisputably true. Healthcare, not only now, but indeed for a long time, since its very beginning, has been a technology industry. A little bit of history. The 29-year-old Ignaz Semmelweis in 1847 incurred the wrath of his senior obstetric colleagues when he suggested that after they performed the post-mortems on their patients who had sadly died in days previously, and then were going on to examine the labouring women in the labour ward, that they should wash their hands in chlorinated solution of lime. Well, they thought this was preposterous. They wore as a badge of honour the blood on their aprons and the blood on their hands. He had established, in fact, that the chlorinated lime solution would prevent the infections. Difficult though his senior colleagues were, calcium hypochlorite had been patented 50 years before, in 1799. An example of chemical technology, resulting in Semmelweis's patients, they indeed had mortalities of less than 1%. 30 years prior to this, in 1816, prior to Semmelweis, the French physician René Laennec invented the stethoscope. Why? He had perfectly good ears. Why would he need a stethoscope? But he, in fact, rolled up his latest statement from the Banque Nationale de Paris, who kept an eye on his finances, and he used that as a mono-oral stethoscope to auscultate the heart sounds of a particularly voluminous woman rather than press his naked ear to her chest. Who in this room has not used a Littmann stethoscope? developed in the 1960s by Professor David Littman at Harvard University. The chlorinated lime solution, the stethoscope, very simple examples of technology with both clinical and social consequences. A 2012 research paper claimed the stethoscope had the highest positive impact on the perceived trustworthiness of the practitioner seen wearing it. So that, better pop that round. And of course, we saw the little girl examining the teddy bear in the ADHD presentation pitch, and you could not doubt that she was trustworthy. An observation not lost, of course, on the producer of TV medical soap dramas. Stethoscope-clad nurses and doctors, very common. Now, my game, anaesthesia, abounds in technology. We have our toys, and we love our toys. William Morton anaesthetised Gilbert Abbott for the surgeon John Warren to nip out a lesion on his neck, way back on 16th of October, 1846. And rather than dripping ether onto a rag, Morton had used a vaporizer that he'd had manufactured so that he could hopefully provide a steady, reliable stream of ether vapor rather than have a disturbing anaesthetic. Through the decades to the current, technological advances in anaesthesia, equipment and monitoring have resulted in the ultimate verification of improved care and decreased risk. And what is that ultimate verification of decreased risk, improved care? Lower medical indemnity insurance premiums. Replacing the anaesthetist. Well, the anaesthetist, I'm pretty sure it's in the trachea with an unequivocal end-tidal CO2 monitor waveform confirming endotracheal intubation has saved many lives in the 40 years it's been around. And I indeed have practiced in those 40 years, along with the other item that came into being in my early days, pulse oximetry, providing confirmation of adequate oxygenation of the tissues, and rather more useful than, I think he looks quite pink. Hand in hand with minimally invasive surgical techniques, laparoscopic, robotic equipment, our patients have consequently had a much lesser need to have very large holes cut in them. And as a consequence, they've slept more easily, and we have too. The real benefits of the technological healthcare industry lie not in the hospital-centric issues that I've just mentioned here, but really on a global basis, the provision of treatments and vaccines for infectious diseases. From the laboratories around the globe, treatments for tuberculosis, polio, smallpox, and of course, of late, why am I giving this as a virtual presentation? COVID-19. The development of the vaccines against the pandemic has been a technological miracle. With our democracies, we accept that not all people utilise technology to the advantage of healthcare and to the provision of information in the best way possible. In the wider world, much of the healthcare information people seek comes via that persuasive piece of technology, the smartphone. For the 2 months of March and April 2020, the prominent infectious diseases social media influencer, Donald J. Trump, made 11 tweets about unproven therapies. These were further mentioned 65 times in White House briefings. The result, a 300% increase in the response on DJT's Twitter account and a doubling of sales of those treatments, unproven, hydroxychloroquine, chloroquine, through Amazon. Money was being made. Healthcare is a technology industry, and as we zoom into the future of healthcare, we must be constantly on the alert to ensure that the technology we're utilising is beneficial to our patients and to the globe on a greater scale, and not in fact disruptive and potentially disturbing. Thank you for your time.
Our first speaker for the opposition, arguing against the proposition that health is now a technology industry, is Queena Scales, a senior exercise physiologist in palliative care. Please make her welcome.
Alrighty, thank you to our audience adjudicators today for allowing us to debate this important topic. And I'd like to thank Lindsay, although he seems to have left us, for that overview of the history of research and development informing technology in healthcare. We agree that these have had important impacts on the delivery of healthcare. However, each development was observed by a person, developed by a person, and implemented to help a person. We argue that ultimately healthcare is a people industry, not a technology industry. Across our three speakers today, myself, Rebecca, who will join us via Zoom, and Tony, will argue how healthcare is defined by people at the patient level, system level, and in the way that technology is developed and implemented. Technology is but one element that contributes to the delivery of healthcare by and for people, as we've heard through the way that Lindsay described our historical developments. Technology does not define our industry, rather healthcare is defined by the people in this room, our healthcare workers, our researchers, and the people in our community that we provide care for and aim to connect with. People are at the centre of everything we do, and patient and family-centred care, not technology-centred care, is what we all strive for and remains our number one priority as healthcare professionals. As stated in an SLHD workforce strategic plan, the greatest asset and most significant investment in our SLHD is its workforce. This sentiment was further echoed by one of our own people just this week when the acting general manager of RPA Hospital opened Innovation Week with a memo that stated, "Our staff are our most valuable resource." We also heard similar sentiments in the panel this morning, and of particular note was a closing statement from Harry, our health consumer, who finished with, "The future of health is human." We're all here to celebrate Innovation Week, where the theme is connection, collaboration, and dreaming big for a bright future. We've been encouraged to come together face-to-face to do those three things. We're here debating in person, and unfortunately have had our colleagues join us via Zoom out of necessity rather than preference. As we know, there is a greater opportunity to engage, connect, and collaborate without the barrier of technology. Connection is ultimately key in the effective delivery of healthcare. When we are most in need, it is people that we turn to in healthcare, not technology. As health professionals, it is our mentors and our teachers we learn from and are guided by. It is our peers we turn to debrief with after a difficult day. And as patients, we seek advice from people, our health professionals, when technology, namely Dr. Google, has led us astray. As family members and carers, we look to people for guidance and support in times of uncertainty, and we seek to be by our loved one's side in their time of need, not present through a screen. To achieve patient and family-centred care, we need to be able to connect with each other. In establishing a connection and therapeutic relationship, both healthcare professionals and patients prefer face-to-face care. Sorry, RPA virtual. In a report published by PwC in March of this year, only 36% of consumers surveyed were comfortable having an initial consultation with their medical provider via virtual care. In turn, meaning that 64% of consumers were not comfortable with an initial appointment being provided virtually. In the same report, only 50% of consumers surveyed reported that they are likely to use virtual care at all. A contributing factor to this may be that healthcare consultations often involve breaking bad news, which is an essential skill and unavoidable component of communication in healthcare. This may be an allied health professional providing advice on length of recovery after illness, a surgeon advising that a procedure has had an unexpected complication, or a nurse or doctor informing a family member that their loved one has passed away. We know the first rule of breaking bad news is to not do it over the phone. And if I asked all of you in this room, whether as health professionals or patients, how you'd like to receive that bad news, I'd bet almost all of you would prefer to receive that face-to-face. It is us, the people, that define our industry of healthcare, and it is us, the people, that drive our industry of healthcare into the future. Thank you.
I'm so glad that you, the people, via the clapper-meter, are making decisions, because I don't know about you, but I'm finding everybody utterly convincing. And I just want to thank you, Quiver Scales, Senior Exercise Physiologist, Palliative Care. Another round of applause. Our second speaker for the affirmative is Dr. Amelia Lewis, Clinical Neuropsychologist in the Disability Support Unit. Please make her welcome.
Thank you, esteemed colleagues and members of the negative team. Look, I'm just a mild-mannered psychologist, naive to the rules of debating, and so I was a bit nervous about coming up here and having to rebut our formidable opponents, and thank goodness they didn't present a single compelling argument. I mean, we've just heard 5 pictures from innovators in the district. Apps, e-learning modules, videos. Nobody's going to get $100,000 for talking nicely and giving hugs. All right. Well, look, healthcare is now a technology industry. We are zooming into the future of healthcare. Our first speaker has already convinced you of the many advantages of the high-tech approach to healthcare. As second speaker, it's now my job to present the next stage of our argument, which is, of course, the perils of the low-tech approach. And what do we mean by low-tech? Human. And what do we mean by human? Imperfect, germ-ridden bags of flesh whose potential to harm other members of our own species is surpassed only by the meerkat, a bloodthirsty horror show that delights in the consumption and murder of its own young. Human beings are basically terrible, and I should know, I'm a psychologist. This is a human brain. 86 billion neurons, each one perfectly configured to transmit messages from one region to another, all to allow us to continue to believe whatever dumb things we want to believe. Think back to 2015 for a second. It was a simpler time when there weren't anti-vaxxers and COVID warriors, just Team White and Gold and Team Blue and Black. Who here remembers the dress? An unparalleled visual perceptual phenomenon that divided humanity to the brink of a cultural war. More than 50% of us saw this as white and gold, and more than 50% of us were wrong, wrong, wrong. It is in fact blue and black. That was our brains duping us by filling in gaps in knowledge with assumptions about lighting and colour. Our brains are actually very good at this, making assumptions, cutting corners. It's known as heuristics, cognitive biases that help us make shortcuts so that we can make decisions more efficiently. And this happens a lot in medicine, when doctors need to make critical, time-pressured decisions under high-stress conditions. But these biases bring with them significant errors. In fact, up to 75% of errors in internal medicine are thought to be cognitive in origin. Who wants to hear some examples? Of course, all of you want to hear examples. All right, let's go. So let's talk a bit about anchoring bias. This is what happens when a person gets fixated on one piece of information when making a decision, even when that information might be irrelevant. So let's say you're shopping for a pair of socks, and you come across a pair for $1,000. And then you come across another pair for $200. And you're like, oh my God, what reasonably priced socks. I'm going to get 3 pairs. It's like printing money. This is an example of anchoring bias. Anchoring bias happens in every profession, but it's especially common in medicine. If you go to your doctor and say, I'm having a heart attack, neglecting to tell them you've just iso-binged an entire meat lover's pizza and washed it down with a nice Shiraz, they're probably going to treat you for a heart attack and not the indigestion that you're suffering. When doctors don't move off their anchors, they might start treating the wrong thing. And this does happen. In a very cool paper published last year, researchers looked in detail at anchoring bias in medicine and the factors that might influence it. And they were particularly interested in rudeness, because that's known to narrow our psychological resources, and whether that might play a role. So they ran a medical simulation with anesthesiology residents in which they had to diagnose and treat a fictional patient. And right before the simulation, they were given an incorrect suggestion about what that patient's diagnosis was. During the simulation, they got lots of feedback that the suggestion was actually incorrect. But for some participants, the researchers had another doctor enter the room prior to the simulation and act rudely. And what they found was that those residents who experienced rudeness kept on treating the anchor diagnosis, killing their fictional patient. Our brains shut down in the presence of rudeness, and people die, you guys, die. And do you know who's pretty much certain to encounter rudeness at work? Healthcare workers. And do you know who really isn't bothered by rudeness at work? Computers. As we stand here, artificial intelligence is being developed that can accurately detect complex conditions from patient data alone. And they say that within 5 years, AI is going to replace most existing protocols for diagnostic decision-making. I mean, it sounds like the right call, right? Can human doctors really compete with the machines? Do you know what? Why don't we test this out? I'm going to pop a pre-op chest x-ray up on the screen. Let's see how quickly the human doctors in the room can figure out what's wrong with this patient and come up with their management plan. Does anyone have any suggestions? Anyone at all? Yep. Yep, that's right. This patient is suffering from a serious case of gorilla heart, and 100% of cases are fatal. Now, if you didn't spot it, don't be embarrassed, because when these case vignettes were distributed online last year, only 34 out of 699 doctors spotted the gorilla. It's a phenomenon known as inattentional blindness. Our brains fail to see things that they aren't expecting. I mean, thank goodness doctors don't have to monitor and respond to unexpected events, am I right? So, in summary, human brains are rubbish, and healthcare now and always will be a technology industry. And if none of what I've said so far has convinced you, I leave you with one final thought. At the end of the day, do we really want doctors' hands capable of producing this quality of handwriting, tinkering around with your internal organs if there is a viable robot alternative? I don't think so. Thank you.
I can't be the only person in the room who's developing a very strong interest in clinical neuropsychology. So thank you very much, Dr. Amelia Lewis. Thank you. Now, our second speaker for the opposition is also going to come in virtually, Dr. Rebecca Davis, Deputy Director of RPA Virtual. Isn't that great? And, well, can't you see? She's virtual and she's coming in virtually. Anyway. And also RPA Emergencies. So please welcome Dr. Rebecca Davis.
Good afternoon, everybody. I wish I was there in person, but I am dialing in due to similar viral reasons as Dr. McBride. Thank you very much for having us here to discuss this very important topic today. Healthcare is not a technology industry. It's an industry of compassion, caring, connection. It's a people industry. Technology can provide us the tools to care for our patients in potentially more efficient ways, sometimes less efficient ways, and innovative ways to do this, but it's not the definition of healthcare. It's not what the industry is centred around, and it's not why we're all here today. Lindsay and Amelia, thank you for your eloquent arguments that further support ours. Healthcare is a service industry about people, not technology. Washing hands is an example of healthcare workers striving to improve care for their patients all the way back in the 1800s. And the stethoscope, has anybody in this room ever tried to use a stethoscope without the years of clinical knowledge that goes into interpreting the sounds that you hear through the other end of it? This is all about people. The stethoscope merely connects your patient to you without assaulting them. That's what it's about. All of these technological tools help us enhance care for our patients and help us connect and provide compassionate and clever ways of managing their healthcare and helping them to feel better and be better. Vaccine development at the extraordinary pace of the last 2 years is another example of collaboration and connection between people. Do you think we could have done this as a global health industry without the connection of people? Technology helped us get there, but the vaccine development was driven by a need to help our communities. And the technology use came from that amazing brain that we saw Amelia show us. All those neurons working in different ways in different people to create the innovation that was required to problem solve the enormously complex issue of how to create a vaccine for a virus that was changing faster than we could test for it. Humans have created all of these technologies and they've done it to help care for their communities. Quiva has spoken about some of the examples of one-to-one connection and humanity that defines healthcare at a personal level. I would like to discuss some of the system structures that support and demonstrate that healthcare is a human and caring industry. If we look at the broader healthcare system, it's all about people. The policies, the politics, and the way we measure it all relates to how healthcare impacts our patients and how we provide that healthcare as healthcare workers. Just 2 weeks ago, Australians voted in our most recent federal election. If we cast our minds back to that wonderful time, to the election campaign where our news feeds were filled with important information and political pitches, So much of it was about healthcare, but they weren't talking about computers or anaesthetic machines. They were talking about people. More GPs in regional areas, more nurses across the board. What aged care needs is more nurses and more carers, more healthcare workers, more people cooking healthy, nutritious food, more connection for those patients. 1,000 more medical student places, bringing in people from other areas, training more people to help enhance healthcare. Healthcare is all about people, and this can be seen in the dollars too. We spent $93 billion on the public health system last year, and over close to 70% of that is on staff and people. 400,000 people, over 400,000 people. These numbers are old. These are like 2019. Dr. Google's not up to date. So 400,000 people are employed by healthcare in the public health system. That is huge. Not only does healthcare support the patients who are our family members, friends, carers, neighbours, but it helps to support the community and the economy. It's all about people. Susan Pearce, our Secretary of Health at the Women's Leadership Breakfast just a couple of days ago, said this: "When I talk to people at the ministry, everyone is there because of the people we serve and care for in our community. At the highest levels, the focus of healthcare is people." PREMs and PROMs have been brought in to help us measure the success of healthcare, and this is across the board. Leading Better Value Care was introduced as the primary way to measure successfully implemented healthcare. Did your health professional listen carefully? Did your health professional explain things in a way that you understood? Did you feel that that was shared care that you were included in? Were you treated with respect and dignity? And we measure our patients' outcomes, We measure their health status, their clinical outcomes, mobility and their quality of life. And it all comes back to the patient. Is healthcare providing an outcome that impacts the people it's meant to serve? These are the markers of success for our industry. Technology used in healthcare is to facilitate patient care. It's not the focus, it's merely a tool. Efficiencies gained are valuable in the technology's impact in allowing us to connect in more ways, like this, like the virtual system. But when it comes down to it, the nuts and bolts, it's all about the people. And if you took away the technology, what you need remaining is the people to look after each other. Every technological gain in the area of healthcare is measured with the PREMs and PROMs and patient-based outcomes, because this is the industry. The community, the patients and us are the core of healthcare. And this is why we've all gravitated towards this as a career and a calling and a way of connecting with our communities. Healthcare industry, our healthcare industry is one of compassion. It's one of connection, collaboration, and all the things that make us human. This is a people industry. And if you, like me, are here for the people that we care for and the people that we know who have been cared for within this system, please agree with our argument at the end of this debate with a round of applause.
Thank you so much, Dr. Rebecca Davis, virtually virtual. Thank you. Our third speaker for the affirmative is Dr. Alice Gray, an RPA immunologist and director of the Basic Physicians Trainee Network. Please make her welcome.
Thanks very much. Look, the negative team seem like very nice people, but they've unfortunately shot themselves in the foot with their very own existence. I'm just gobsmacked to get up here and see Dr. Rebecca Davis, poster child of RPA Virtual, trying to argue that healthcare is not a technology industry. As I'm sure you're all aware, I thought she was going to mention it, but she seemed to leave it out of her speech. RPA Virtual delivered healthcare in a tech-enabled way to thousands of people during the pandemic. It was creative, it was safe, it was efficient, and it really let us meet the needs of our patients. So clearly, healthcare is a technology industry. And negative team, we think people are great. We're not proposing getting rid of healthcare workers and replacing them with robots. However, I would have to say that physical examination of patients is highly overrated. I'm an immunologist. I barely know one end of the stethoscope from another. Even our cardiologists, who definitely do know one end of the stethoscope from another, they do an echocardiogram on every single patient to diagnose valvular heart disease. Why is that? Some might say the Medicare billings. It's because it's more... Perhaps, but it's also because it's more accurate. So look, I want to start off with with a sort of formal part of my speech by just acknowledging that technology in healthcare can sometimes be a little bit idiosyncratic. Yes, I might move my slide on. Yes, we are the only industry, apart from drug dealers, who still use pagers. Yes, the ancient and humble fax machine is still a major part of professional life for many of us. But I think the criticisms of faxes and pagers are a little unwarranted. For starters, we stopped using carrier pigeons at least 10 years ago, so I'm not sure what everyone's complaining about. In addition, technology has a very specific set of healthcare needs, of technology needs, and some of our rather quaint tech solutions fill these needs perfectly. Take faxes. Sure, they are slow and some people might say outdated, but they're also secure, preserving our patients' confidentiality. And they're just a little bit unreliable, which adds some much needed excitement and unpredictability to the day. And likewise, pagers have their undersung benefits. Compare them to iPhones, which are the Mariah Carey of communication. Beautiful, expensive, but total divas that are full of demands and won't work unless the conditions are right. Running out of batteries in 3 hours, losing phone reception. Pagers, on the other hand, are more like the Elvis impersonator that comes to your local pub. They're not very attractive. You really want to get up close to them, but you know they're going to turn up and get the job done. So setting aside some of our older technology, I can tell you that one group of staff who really exemplify how important tech is to healthcare is our younger staff. Funnily enough, I actually used to think of myself as a younger staff member until I started my current job supervising a large group of junior doctors. One of them kindly told me that apparently my generation is referred to as the geriatric millennials. So that was a real confidence boost. And certainly, I can see the gap between the tech that I'm comfortable with and their approach to tech in healthcare. When I was doing my medical training, not so long ago, we used to think that using an automatic blood pressure cuff was pretty exciting. Nowadays, trainees learn across a range of social media, including WhatsApp, Teams, TikTok, Snapchat, and Messenger. This photo, which was kindly provided by the neurology department, I think really nicely emphasises this gap in the use of technology. Here we have the senior neurology consultant, inexplicably wearing a safari suit, puzzling over a NIST score, while the registrar has already calculated the score on his iPhone, ordered coffees for the entire team, and is probably doing a few cryptocurrency trades as well. Another way to understand how important technology is to healthcare is to understand all the amazing advances in the different specialties in healthcare fields. If you look up here, urologists, they're now operating with robots. We've got the intensive care team putting people on ECMO and keeping them alive. Our nursing staff are able to round on patients with COVID using iPads. And we have oncologists giving people immunotherapy to treat cancer. And I even hear that the orthopaedic surgeons have a new kind of hammer. Now, it wouldn't be a debate in 2022 if I couldn't talk about COVID, everyone's favourite pathogenic respiratory virus. COVID has done a lot of things, but it has done one very positive thing, which is highlight the really important role of tech in healthcare. Pre-COVID, Hollywood had this funny conception that the glamorous doctors and nurses of Grey's Anatomy were the real pin-up boys and girls of medicine. No longer. We know who the true healthcare heroes are now. IT. Who do you call when you're a COVID close contact and you're at home and you need urgent access to EMR? IT. Who do you call when your daughter has put a giant cat face as a Zoom filter on and you can't get it off? IT. Who do you call when one of your colleagues has forgotten to mute their Zoom microphone and has gone to the bathroom during a 50-person MDT? Probably more of an HR issue, actually, and I really wish that was a hypothetical scenario. So I'm rapidly running out of time, but I thought I'd finish up by showing some of the numerous examples of how we have innovated healthcare during the pandemic to serve our patients and to deliver truly patient-centred care. So the neurology team at RPA implemented a virtual ward round, so they had patients, 2 doctors rounding on the patients and then live streaming it to the team who was in a tutorial room. Our public health team used complex bioinformatics to map the pandemic and to pivot their responses. Telehealth has allowed us to deliver medical care to patients in rural and remote New South Wales without them needing to travel all the way to Sydney. And then, of course, all the small points of happiness and human connection that technology brought us during the pandemic. Getting to watch my head of department show just this incredible amount of love for his puppy on a Zoom meeting. Seeing this amazing array of crazy Zoom filters that people have. And of course, all the fantastic, creative MDOK social media campaigns bringing us together and boosting our morale during the pandemic. So as I'm sure our team has now convinced you, we are zooming forward into the future. Scientific advances have changed outcomes for a huge variety of conditions. Communication technology allows us to connect as colleagues and as human beings. And a healthcare industry that's predicated on technology allows us to deliver truly patient-centred care. Thank you.
Ladies and gentlemen, Dr. Alice Gray, thank you so much. Thank you. Well, our final speaker in the debate, and then I'll come to you with the clapper-meter. Our third speaker for the opposition, I would ask you to welcome Mr. Tony Tu, Digital Health Coach.
All right. So thanks, everyone. Hopefully, symposium has been pretty good, pretty interesting. So for those that do know me, I'm actually quite a shy and timid guy. So being up here is pretty big. So thanks for giving me the opportunity. So to begin, our opponents on the affirmative have tried to speak towards the idea that health is now a technology industry. In summary, they've mentioned that technology is the future, and technology has improved the efficiency in health. For those that were here earlier today, there was a very good point raised from one of our panel members in the panel discussion. The tech industry often confuses the value of technology as something we use as a substitute for what we want to do in person. They often get fixated on improving technologies purely for the sake of improving efficiency, to make up for something we think we've lost or to think we need. Efficiency is important, don't get me wrong, but it's not why, as an industry, we innovate. Efficiency is not why we have created new technologies in healthcare, nor is efficiency the greatest strength of how we use technology. It's an important concept to fully appreciate, and if we lose sight of the understanding of why we do something, we lose sight of the goal being our humanity. We may end up in a situation where we simply have improved how we measure healthcare without actually improving how we've delivered the healthcare. Because as a clinician myself, it's not about how quickly I can see a patient or review a patient. It's not about how many patients I can see during business hours, because ultimately, health is not a transaction. The second point that the affirmative team mentioned was technology is the future. Fixation on the future often results in ignoring the present and those living in the present. There was a very good question by one of our audience members this morning as well. What happens to people without phones? By extension, what happens to those technology leaves behind? Not everyone in this room, I'm sure, has the latest iPhone or Android phone. What does that mean for you? I'll be honest, you get left behind. You miss out. Now, you can see where I'm going with this. Unlike the tech industry, the idea of being left behind or leaving someone behind is not a compatible concept with health and healthcare. As Australians, a core concept of our identity is that we pride ourselves being there for our mates. You have my back, I have yours. It's just the way it is. Health as an industry in Australia shouldn't be only for those who can afford it and for those who've kept up. It should be for everyone. From this so far, I'm sure you're coming to understand our take on the topic. I want to bring your attention towards the idea of value. What do we value as health as an industry? What are we thankful for? It wasn't the technology that helped us as a population overcome COVID-19. It was the people. We thank our clinicians on the front line. We thank the support staff at our hospitals. We thank our researchers, and we thank our digital health teams for improving us and innovating our way as we stayed afloat during the pandemic. We do this because it was us, the people, who connected. It was us, the people, who collaborated. It was us, through our hard work and through the unwavering dedication, our unwavering dedication to the people, and it wasn't technology who dreamt big. It wasn't technology who innovated our way through this pandemic. It was us, the people. As a team representing clinicians and digital health in front of you today, we truly believe that the core values of health, those being collaboration, openness, respect, and empowerment, are representative of an industry of people and humanity, not technology. Our patients aren't our customers. our staff aren't what tech call our end users. Health isn't about efficiency. Health isn't transactional. Health isn't only for those who can keep up with the latest trends and for those who can afford it. Health is for everyone. It's an industry focused on the provision of care from the people to the people. Health is an industry that represents everything that is good about humankind as a species. It's an industry that is reflective of the humanity behind the mask that we show one another and the humanity that has driven us to care and help one another in our most dire moments of need. So in closing, the idea that health is now a technology industry is wrong. Health is, and always has been, a people industry, it's a human industry, and it's a caring industry. Thank you very much.
Thank you. Thank you very much to Dr. Tony Tu. I want to invite now onto the stage Dr. Andrew Halloran, who's going to bring a trophy. And as he moves with odd alacrity and brings a trophy with him, I'm going to remind you that the topic is healthcare is now a technology industry. Get your clapo hands ready. If you believe that the affirmative team won that argument and successfully, if you're voting for the affirmative, clap now. Thank you very much. You're watching this, sir? I may need help. And if you believe that the negative team won, the opposition, vote clap now. Oh, Jesus. Oh, God. Oh. Ladies and gentlemen, I am one of 5 children. If there's one thing I hate, it's the lack of a clear winner. But I'm going to have to tell you, I've been clapo meeting for years, and I honestly think a fair thing is to say that was a tie. Can you help me? I'm looking at the lady who works and stops people falling over. If you can't trust a nurse with that goal, who can you trust? Ladies and gentlemen, I don't know what we're going to do about that. It's going to have to be written on, but I declare this absolutely equal. Listen, very quickly, come together so we get a photo of everybody together. We need our man with the, I'm so sorry, the virtual people. Squish in closely. I won't be there. I'm merely the MC. Look down the barrel of the camera and look extraordinarily excited. Thank you very much. A big round of applause. I need to go, unfortunately.